there's a possibility you suffer from sleep apnea, having a sleep study could be the first step to changing your life for the better. STAT, Sleep Therapy Associates of Texas, is here to guide you through the process with ease and comfort.
I snore, I rattle the rafters, and then when your wife tells you quit breathing at night and she pounds on your back to make you breathe, you begin to wonder if something's wrong with you.
Harry Power had a big problem. He suffered frequent headaches, and every day about 2 or 3 in the afternoon, he would hit a wall of exhaustion.
You just get sleepy, you get lethargic, you have no energy, you want to go somewhere and sleep. Sometimes you tend to nod off in meetings, which doesn't exactly keep the boss happy from time to time. There wasn't any pain to it, it was just like you wanted to go back to sleep. You hadn't gotten enough sleep for that night before.
At his wife's urging, he finally came here to STAT for a sleep study.
I can see here that there certainly was a difference in the breathing.
STAT doctor Alex Carvalho uses data recovered from monitors hooked up while you're sleeping to diagnose any possible sleep disorders, the most common being sleep apnea.
So I'm just going to start by attaching one in the center here as a ground wire and then behind the ears.
But basically you're trying to see the brainwave function, the breathing function, and the oxygen function, the heart function of the patient during the sleep, okay? With these types of information, we can tell you if you have sleep apnea or not.
Sleep apnea happens when your airway collapses throughout the night, causing you to stop breathing for short periods of time.
You are basically being asphyxiated, granted it's a very short period of time and it's reversible, and all night long.
Symptoms can include feeling tired even after sleeping for several hours, headaches, difficulty focusing, or in some cases, no symptoms at all. And sleep apnea can be extremely dangerous.
Depends, of course, on the severity of the illness. You can have mild sleep apnea, moderate, or severe. And severe sleep apnea is a very important condition. It's dangerous, and when undiagnosed, it can convey a great deal of sickness to a patient. You think about any cardiovascular disease that you can think of, it will be aggravated by sleep apnea.
When you have a sleep study at STAT, you come in a couple hours before going to sleep. Harry couldn't believe the accommodations. From plush bedding to flat-screen TVs, it felt more like a hotel than a place for a medical test.
It made it so much better because you're not in a hospital environment. You're not in something that's a sterile environment. I mean, this looks like something that you would have at your friend's house or a nice hotel room when you're out traveling.
STAT aims to put patients at ease with a soothing and comfortable atmosphere. And with multiple locations across North Texas, it couldn't be more convenient.
Well, will these be on me all night?
Yes, sir, these will be on all night.
In the end, the doctor diagnosed Harry with mild sleep apnea.
I have an opportunity to reverse that and to get my health back.
However, sleep apnea doesn't only affect adults.
If you look at data in terms of incidence, it's approximately 5 to 7% of kids can have obstructive sleep apnea. And what's very extraordinary about kids is that they don't have the type of symptoms that adults have.
Instead, symptoms in children include inattentiveness, learning disabilities, restlessness, agitation, impulsiveness, or aggressive behavior. In many cases, a child with sleep apnea is incorrectly diagnosed with ADHD.
That's frequently the problem with children with sleep apnea.
For that reason, STAT's facilities also test children.
Brooke, what we're going to be doing tonight is monitoring you while you sleep.
9-year-old Brooke Aaron spent a stress-free night at STAT with her mother in the next room.
I feel comfortable and all the people are nice to me.
In the end, diagnosing sleep apnea can be the key to living a healthier life.
Sleep apnea is not only a mild problem or a disruption of your sleep, it's actually a significant health problem that needs to be taken care of and can make your quality of life much better.
The good news is that most sleep disorders can be easily treated, but the key is letting STAT diagnose the problem before it becomes dangerous.